Hey guys, it's Jess. This video was recorded spontaneously when I met someone who was qualified to address a need parents have been asking me about while hiking today. It was very windy out. The sound quality of this video is poor. I almost didn't post this, but the content is very valuable for families. Thank you for your understanding. The captions are on for your convenience.
Hey guys, it's Jess. So one of the things I always want you to know on this channel is no matter what I'm doing, I'm thinking about your family and I'm trying to figure out how I can serve you in a greater capacity. So today I was hiking, I went to this brand new hiking meetup and I was talking to some people. So yesterday I asked a few parents who have children with autism, if I could make any video for you, what would you want to know about? And the one thing that kept coming up is how to help children who need to have blood drawn. Well, I am not qualified to really do that. I'm not qualified to talk about that. But I was committed to finding someone who was qualified. And so today I was hiking, and it turns out that with me is Amanda, who's a pediatric nurse, and she is amazing with kids. Like, no kid wants to get a shot, but she's like the person that kids would want to go to if they did have to get a shot. And she's just going to share with you a little bit about what you can do ahead of time to prepare your child for the experience, and a little bit about what you can do during the process to make it easier. So Amanda, thanks so much for sharing with us.
No problem.
So what can parents do ahead of time to help prepare their children for getting an injection or getting their blood drawn to make the experience not so traumatic?
I find that a lot of children coming to me already have had some kind of a past trauma and they're terrified by the time they know that they're going to get the shot. I try and just give them as much choice in the matter as possible. Children don't have a lot of choice in their lives. You're told when to get up and when to eat. But if I can, if possible, I let them choose, okay, we need to have a shot today. Which arm can I have? Which site can I use? And I try and give them as much choice as possible. I find that they feel a little bit more control in the situation.
Awesome. Now, you also talked about parents, if they know their child has to get an injection ahead of time. Now, obviously, you may not know, right? So it's important to have both sides of the equation, but that parents can actually get a cream to help to numb the area so it's not as painful. Can you tell us a little bit about that and what parents would need to do if they wanted to talk to the doctor about that?
Correct. There is a prescription medication called Amla Cream, EMLA, and there's also a over-the-counter version that's just straight lidocaine that can be used. Applied topically. It is not a systemic medication. They're only to use it at the site that needs to be used. And you should apply it about 30 minutes ahead of time, and it numbs the skin. So if you know ahead of time that your child is going to have an injection and you know which side or site to use, if they're going to have blood drawn, you apply it to the same place. It just helps to numb it and maybe decrease the pain, especially with autistic children. Their sense of touch is so much stronger and greater than most people. Their sense of pain as well. So anything that we can do to help the process really is helpful.
Yeah, awesome. And Amanda brings up a good point. A lot of times children with autism, they can fall on either end of the spectrum. Either they're hypersensitive, so touch, and I've experienced hypersensitivity in my own body briefly when I was going through an autoimmune disease. And when I touched my skin, I went to get blood work done, and I pulled my arm back, and it wasn't even the needle, it was the nurse touching my skin that hurt. So being aware of that can be really helpful. And then there's actually the opposite side of the spectrum where children sometimes with autism don't have any reaction to pain. So your children might fall in either one of those categories. Now, what about, Amanda, one of the things parents often ask is, okay, well, should I make it a surprise? Should I tell my child a week ahead of time? Should I tell them the day before, right before we go in? Should children, is it worse to tell them ahead of time, maybe they'll have more anxiety, or is it better to give them time to prepare themselves?
I think that also depends on the child. Now remember, as the parent, you know your child best. You know how they're going to react. I try and be as upfront and honest with children at all times. They will come and they will ask me, am I going to get a shot? If I know they're going to get a shot, I'm honest. If I say that they're not, I try and be as honest as possible and as upfront. I had a situation earlier this week where one little girl needed to get her flu shot and she had a meltdown and she just couldn't do it. So I calmed her down and I had her pick the date on the schedule that she wanted to come back so she could mentally prepare herself. So she knows she's going to get a shot and she's going to be okay, well, more or less okay with it on that day.
Awesome. And yes, and when it comes to children with autism, it's important to understand that children with autism, like everybody else, have different abilities to understand what's going on. But more often, children with autism will fall either on the fact that they have a lot of anxiety and they might need a lot of preparation, or they may not understand what's happening. And I think for a lot of times, children, that might be the scariest part, is not even knowing what's going on. So, what about those cases where a child truly can't understand what's happening? You do have these experiences with kids that they need to be held down. And I think that's typical for all children. And what would you say to a parent who's experiencing, this anxiety and is thinking, am I doing the right thing by getting their kids blood drawn or injection, when it really is traumatic? And the bottom line is nothing can be done to help the fact that maybe they're 2.5 and they're going to squirt. You're going to have to hold them to get that shot. What would you say to a parent who's going through that?
Oh, absolutely. And it's just as anxiety inducing for the parents as well. And they feel terrible because we do have a lot of toddlers in our practice that need skin testing and they don't understand what's going on. So in that case, I will try and have distractions prepared. I have little things of bubbles in every single room. And the minute it's over with, I start blowing the bubbles. And a lot of kids, distraction is key. I also like to show them what we're going to be using and just get them prepared as much as possible. Here's what we're going to do. This is how long it takes. We all count to 10 together, just to try and get them aware of what's going to happen. Otherwise, it's the anticipation that really scares most children, I think.
Awesome. Well, this was some great advice, and I really hope you found this information really valuable. And if you have, I want you to go to my website, hopeeducationservices.com, because there is so much content just like this on real topics parents ask me about. I'd say 80% of the content that I make is a question a parent asked. So if you have any questions, you can email me. Just jump onto my website, you'll get on my list, you'll get an email from me sending you some free ebooks, and then just reply to them with your questions. So I really look forward to staying in touch with you. Amanda, thank you so much for your advice. I really appreciate it.